Hi guys, this is a video case presentation about an interdisciplinary approach to amelogenesis imperfecta, made by Zafra Paul Dominic,
Okot Joseph Laurie.
Albarillo Blair.
and Tavis Dayan.
Introduction. Dental hard tissue mineralization flaws can have an impact on the dentine and/or enamel. A uncommon inherited illness called amelogenesis imperfecta results in structural abnormalities in the teeth. Loss of tooth structure, particularly wear of enamel with exposed dentine at the occlusal surface of the posterior teeth, are the major characteristics. Dental sensitivity, a propensity for caries development, attrition, and a reduction in vertical dimension are just a few of the clinical outcomes that can occur when there is insufficient enamel tissue. Chief complaint: tooth discoloration, diastema, unsatisfactory aesthetics, and slight tooth sensitivity. Case report: a 20 years old woman was referred to Gazi University Department of Prosthodontics with the chief complaint of tooth discoloration, diastema, unsatisfactory aesthetics, and slight tooth sensitivity. The medical and dental history revealed that the patient's family was not affected by AI. A renal ultrasound scan was normal, and it showed no evidence of nephrocalcinosis. Laboratory findings including serum electrolytes, calcium, phosphate, urea, creatinine, alkaline phosphatase, and parathormone levels were all normal. Clinical examination of the patient showed that the inefficient enamel thickness and patient's anterior and posterior teeth were discolored. Patient demographic: gender female, age 20. Initial examination findings: upon clinical examination, the patient's anterior and posterior teeth were discolored and the patient's enamel thickness was found to be insufficient. Additionally, the panoramic radiography demonstrated that the underlying dentine could not be differentiated from the thin enamel covering. There were no missing teeth or anterior open bites. The other clinical findings, however, include short crowns, numerous diastemas, occlusal wear with exposed dentine in the posterior portions, weak contact points, and dental cavities. The roots had a typical length and shape, and the pulp chambers had standard dimensions. Her oral hygiene was adequate, and she showed no symptoms of gingivitis. Treatment planning. Under local anesthesia, all teeth were prepared with camphor margins. The crown length of the maxillary and mandibular posterior teeth was insufficient for crown retention. In addition, there was an asymmetry of the gingival contours in the anterior maxillary teeth. After periodontal evaluation, because of insufficient crown length, ostectomy procedure was performed for maxillary and mandibular posterior teeth. In addition, gingivectomy was applied for maxillary anterior teeth. All periodontal surgery procedures were performed by the periodontologist. The impressions for provisional cast were made with a condensation silicone impression material. Then, an interocclusal record was prepared with a hard adhesion type A silicone material at the increased vertical dimension, which was determined in diagnostic wax-up stage. The autopolymerizing acrylic resin provisional crowns were fabricated at the determined vertical dimension extraorally by an indirect method. Then, they were cemented with temporary cement.
For the collaborations, two interdisciplinary approaches were made, and these were prosthodontist and a periodontist were involved in making this treatment being successful. The role of the periodontist was to thoroughly evaluate and maintain the health of the surrounding structures. In what way? By examining the gums, the teeth, and any other supporting structures, so as to ensure no potential infections or abnormalities that will later cause any problems while the prosthesis would have been placed. By the periodontist carefully monitoring and addressing the periodontal issues addressed, the periodontist played a very important role in preparing the environment for future prosthesis fabrication. After the periodontic rehabilitation, the prosthodontic was now sure that he will be able to fabricate the prosthesis and they will be able to function well without any future or any problems to the patient. The two interdisciplinary professions, while working together, they will be able to ensure a successful outcome of the patient's treatment. In addition to the intraoral images and panoramic radiograph that were used, other imaging techniques had to be incorporated in order to determine the correct diagnosis. And these additional techniques served as a complementary tool to provide a more comprehensive evaluation of the patient's conditions. The incorporated techniques were a scanning electron microscope and a histologic analysis. The scanning electron microscope, this is a technology that is extremely helpful in examining the structures of the enamel due to its exceptional high resolution capability, especially when it comes to hard surfaces. The results obtained from this analysis clearly indicated an insufficiency in the enamel, which ultimately led to the confirmation of the diagnosis of amelogenesis imperfection. Histological analysis. This is a proficient technique used to analyze the histological features, in particular the dentine. The results that the histological analysis portrayed were the dentine had any imperfections, and also and it being regular with no loss of any tubular structures. Periodontics. These are the procedures and techniques that were used. First, there was a periodontal evaluation that was done, and in the periodontal evaluation, the periodontist thoroughly examined the teeth, the gums, checking any signs of inflammation, bleeding, or plaque buildup. After the evaluation, the periodontist realized that there was insufficient crown length. Thus, he performed osteectomy, and this was performed on the maxillary and the mandibular posterior teeth so that there will be sufficient space for the fabrication of the prosthesis. Lastly, the periodontist had to perform gingivectomy, and this was to expose more tooth structure so as the prosthesis will be able to have enough bulk and rigidity while they were placed by the prosthodontist. Prosthodontics. Here we'll be talking about the procedures and techniques that were used. Firstly, the prosthodontist had to analyze the centric occlusion of the patient. And how did he do this? By using a diagnostic cast and a semi-adjustable articulator. This is very efficient to analyze the centric occlusion of the patient so as to be able to know the bite or any discrepancies in the patient's occlusion. Next, the prosthodontist fabricated a diagnostic cast workshop and used a smile design software for the treatment outcomes. In this part, this was very important so as the prosthodontist will be able to predict the last appearance of the restoration and able to know what is the expected treatment outcome of the patient. Next is tooth preparation, and in this aspect, this is where the prosthodontist had to prepare the tooth, whereby the prosthesis will come and sit. But in this case, the prosthodontist had to use a specific kind of margin so as it can be able to suit the diagnosis that was given. And in this case, the prosthodontist used a chamfer margin on all the margins and all the surfaces of the teeth. Next was impression taking and temporary crown fitting. The impressions of the provisional cast were made with a condensation silicone impression material, and the crowns were fabricated at the determination of the particle dimension, and these crowns were fabricated extraorally by an indirect method, and also they were cemented with using a temporary kind of cement because these crowns were temporary and they were just used to check if the final prosthesis will be functional and best for the patient. Next is the occlusal registration and faceboard transfer. In the occlusal registration, it was obtained with a hard additional type A silicone material with a slightly reduced particle dimension from the provisional restoration. The importance of the faceboard transfer is to be able to relate the prosthesis with the anatomical structures of the face of the patient. This is because if the prosthesis does not work in occlusion with the anatomical structures of the patient, then it will be able to destroy the structures such as the TMJ, and this will instill or will bring other complications to the patient. Lastly was the fabrication of the dentures and the fitting. The prosthodontist used two types of metals in the fabrication of this prosthesis. In the posterior aspect, he used ceramic kind of metals. And why did he use ceramic? This is because the posterior part had been chronically infected by the amelogenesis imperfecta, and thus the ceramic will be able to articulate with the color and also be able to camouflage with the condition. In the anterior portion, the prosthodontist used zirconia ceramic crown so as to be able to have the perfect aesthetic, because the anterior portion, this is where the teeth are first seen, or this is the first impression that one sees when the patient smiles. Lastly was the fitting. The fitting was done by different kinds of cements, because the materials that were used on the posterior was ceramic, and thus it's kind of cement to cement the prosthesis cannot also be used on the anterior portion. And lastly, the patient was encouraged on proper oral hygiene and how she can be able to maintain the prosthesis that she had been fabricated.
The results and outcome of the study will include information on interdisciplinary treatment, clinical improvements, patient satisfaction, and long-term success. With the result, mastication function and facial appearance are enhanced after the full mouth prosthetic rehabilitation, and there was no tooth sensitivity or complication related to temporomandibular joint. Radiographical examination. As you can see in this picture, this is a post-operative panoramic radiograph. Zirconia-based ceramic crowns in anterior and metal ceramic restoration in posterior. Clinical examination. This picture is after treatment facial photography. The patient was very happy with the results in terms of aesthetic, functions, and phonation during speech. Radiographical and clinical examinations revealed no evidence of any problems associated with the restored teeth or periodontal structures. Regular clinical and radiological follow-up with visual and radiographic examination was performed at the 3rd, 6th, 12th, 24th, and 3rd year post-operatively. 3 years later, the patient was still happy with the function, dental aesthetics, and facial harmony.
This discussion is composed of an overall review of the case that has been presented. The patient is diagnosed with hypoplastic amelogenesis imperfecta, and the whole treatment plan was based on an interdisciplinary approach that consisted both periodontology and prosthodontology. The maxillary and mandibular left third molars were extracted to do scanning electron microscopy and histological analysis. The results pointed to an intact dentin but insufficient enamel layer with irregular structure. Thus, a decision to have a full mouth prosthetic rehabilitation with all ceramic or porcelain fused to metal restorations was made. A full mouth fixed prosthesis was indicated because soft and hard tissues are completed until 18 to 20 years old. The height of the crown on the back teeth of both the upper and lower jaw needed to be increased in order to create a larger surface area that would help retain dental restorations. Surgical bone removal or ostectomy was performed on the back teeth on both of the upper and lower jaw due to insufficient gum width and to establish the proper distance between the tooth and gum for health. Gum tissue removal, gingivectomy, was carried out on the upper front teeth to achieve a balanced gum appearance. The patient's treatment involved a fixed partial denture that spanned the entire mouth. Zirconia-based ceramic crowns were used for the anterior teeth, while metal ceramic restorations were placed on the posterior teeth. Zirconia-based all ceramic crowns were chosen for the anterior teeth to enhance the appearance by concealing underlying tooth discoloration and restoring the front area. The patient's proper bite position or centric occlusion was adjusted based on their reproducible jaw position or centric relation, ensuring that the posterior teeth received even and centered pressure when biting down. After undergoing complete oral prosthetic restoration, the patient experienced enhanced chewing ability and a more pleasant facial look. The patient was advised to schedule routine follow-up visits to ensure the ongoing effectiveness of the comprehensive dental work. and to monitor the young adults patient's adjustment phase. This similar clinical case outlines the oral restoration process for a young patient who has been diagnosed with a hypoplastic form of amelogenesis imperfecta affecting the posterior teeth, and the hypomatured form of amelogenesis imperfecta affecting the front teeth. There was evidence of crown resorption prior to eruption in teeth numbers 2 and 18. Additionally, the patient exhibited swollen and red gum tissue, closely situated roots, and an omega-shaped upper dental arch. Typical abnormalities often observed in individuals with amelogenesis imperfecta, as observed in this particular case. Furthermore, teeth numbers 1, 2, 16, and 18 were identified as impacted. In relation to the first case presented, amelogenesis imperfecta is a developmental condition that can lead to diminished oral well-being and contribute to emotional challenges. As a result, individuals affected by this condition require comprehensive care. Successful management involves a coordinated approach encompassing orthodontic, periodontal, prosthodontic, and restorative interventions, while taking into account the patient's preferences, needs, and financial circumstances. Initiating treatment at an early age for those with amelogenesis imperfecta can effectively halt the gradual dental deterioration and mitigate the psychological effects associated with this disorder. In conclusion, utilizing fixed prosthodontics is a rational approach in addressing amelogenesis imperfecta to reinstate both functional capacity and aesthetic appeal. The durable effectiveness of fixed prosthodontics offers benefits in averting additional deterioration linked to occlusal erosion or disruptions to vertical growth. All studies highlighted in this presentation was properly cited, and there is also the addition of copyright policy for this video. Thank you for listening. Have a good day.